In this next video of the lesson, Health Insurance Underwriting, we will learn about risk assessment and the factors that affect the chance of illness. Underwriting is a process of risk selection which is based upon the characteristics of a group or individual. Based on the degree of risk, the underwriter decides whether to accept the risk or not and at what price. This classification is normally done through standard acceptance charts, whereby every represented risk is quantified and premiums are calculated accordingly. An individual who is diabetic has a far higher chance of developing a cardiac or kidney complication requiring hospitalization than of death. Also, health episodes can happen multiple times during the course of insurance coverage. A life insurance underwriting guideline might rate this individual as an average risk, but for medical underwriting, he would be rated as a higher risk. In health insurance, there is higher focus on the medical or health findings than the financial or income-based underwriting. The factors which affect morbidity or risk of falling ill, and that should be considered carefully while assessing risk, are as follows. First, age. Premiums are charged corresponding with age and the degree of risk. For example, the morbidity premiums for infants and children are higher than young adults due to increased risk of infections and accidents. Second, gender. Women are exposed to additional risk of morbidity during childbearing period. However, men are more likely to get affected by heart attacks and job-related accidents than women, as they may be more involved in hazardous employment. Third, habits. Consumption of tobacco, alcohol or narcotics in any form has a direct bearing on the morbidity risk. Fourth, occupation. Extra risk to accidents is possible in certain occupations such as driving, blasting, aviation, etc. Fifth, family history. This has greater relevance as genetic factors influence diseases like asthma, diabetes, and certain cancers. This does impact the morbidity and should be taken into consideration while accepting risk. Sixth, build. Stout, thin, or average build may also be linked to morbidity in certain groups. Seventh, past illness or surgery. It has to be ascertained whether the past illness has any possibility of causing increased physical weakness or even recur, and accordingly the policy terms should be decided. Eighth, current health status. It is important to ascertain the degree of risk and insurability that can be established by proper disclosure and medical examination. And ninth, environment and residence. These also have a bearing on morbidity rates. Thank you.